And so when I explain to people that there are a lot of different types of single-payer systems, you can have purely socialized medicine. That's kind of like what England has. The government owns the hospitals, the government owns the clinics, the government finances all the health care, and all the doctors work for the government. That is truly socialized medicine. As opposed to the Canadian system, where the financing comes through their Medicare program, but all the doctors are in private practice, and so that's kind of the spectrum, so to speak.
And when you hear the candidates debating health care, do you think that they really do differ? And why do you think they don't go with, as Hillary Clinton started at the beginning, we heard the clip where she was talking about the options. She started by saying, well, single payer is an option. Many people cheered in the audience, and she went on to say that wasn't likely.
Yeah. Well, I think that part of the problem is that our current healthcare system is so entrenched with the system that we have. We have this plurality of systems where we actually have a single-payer system, which is Medicare. We have another single-payer system for Medicaid for the poor. And then we've got private insurance, which is a speckling of all kinds of crazy things. You know, this industry is a $2 trillion industry, and the profits in the for-profit insurance industry are so huge and it's so deeply entrenched into Wall Street that this country's going to have a hard time extracting that. And I think that Barack Obama and Hillary Clinton understand that, and they don't want to go ripping up this system for the sake of an ideal. But the fact of the matter is until we move to a single-payer system and get rid of the profit motive in financing of healthcare, we will not be able to fix the problems that we have. They will be impossible to fix.
What do you think is the single biggest misunderstanding about single-payer in this country, and what is your strategy for having it adopted? What do the polls in the United States show of how Americans feel? You know, it's interesting. As you see the polls, as you've seen them move through from about 1999 up to the present, you're seeing an ever-increasing number of people starting to support a national health program. And in fact, there was a recent poll that came back from one of the medical associations back east and was just published in JAMA a couple of weeks ago. The Journal of the American Medical Association. The Journal of the American Medical Association, which shows that 59% of practicing physicians today believe that we need to have a national health program. I mean, that's unheard of even 10 years ago. I mean, they were the biggest group opposed because of the finances. Oh, I mean, that's it. I mean, you know, physicians traditionally have been the group that has been the anchor sunk into the mud that has been dragging this whole healthcare reform process along. In fact, the AMA, the American Medical Association, launched a huge effort back in the 1960s to stop Medicaid and Medicare. And so it's amazing to see a new generation of physicians coming up who are disgusted with our current healthcare system. You know, we're trained to be advocates of patients. We're trained to save lives. We're trained to practice medicine. And instead what we're doing is we're practicing Wall Street economics. And they're two diametrically opposed. So how do you inject this idea into the presidential debate? What it's going to take is it's going to take pressure from the bottom up. You know, I think that our current presidential candidates, I think both of them understand that ideally single payer would be the best, but they don't have the political will to move that forward. And so it's going to take, I use it for this example. I said, you know, as the governor of the state of Colorado or the president of the United States, their job is to feel which way the wind is blowing. Our job is to turn that wind. And that happens by me coming down and speaking to you this morning. I go out and talk to Kiwanis groups and Rotary groups. And especially the thing that I've been doing is going around and speaking with my fellow physicians, because it's surprising how many doctors don't even understand the system.
I'll have to admit that 8 years ago, I didn't understand the system. And I think once people understand the system and understand what's wrong with it, they're going to do the same thing that I did.
The American College of Physicians has endorsed. This is your association.
That's my association of internal medicines. American College of Physicians, they gave a dual support, so to speak. They said if we're going to fix the system, we either have to do this or this. And surprisingly, one of those was a single-payer system.
Well, I want to thank you very much for joining us. This is the beginning of a more extended conversation. C. Rocky White has been our guest. He has revised and updated the book by Robert Lebeau, Healthcare Meltdown, Confronting the Myths and Fixing Our Failing System. This is Democracy Now!, democracynow.org, The War and Peace Report. We're broadcasting from KBDI, public broadcasting here in Denver. We'll be back in a minute.
Thank you, Amy.
Thank you very much.
When it's looking dark and gloomy and you need a little cheer, some other crook or crony telling lies and spreading fear. Hatch a clever joke and just bedevil the do-batters. Raise some hell, raise some kick-ass kitchen clatter. Soup pot, stew pot, souffle pan. Grab a wooden spoon and start stirring up a plan. And that's all yours truly, Molly Ivins. Stop the war, get in the street and start jiving. Come on, people, would you raise a little hell? You know things are not going so well. If you don't make a noise, no one's gonna hear a sound. We are the people who will turn this place around. There's something about politics I came to preach today, and I'm very, very serious about what I'm gonna say. Y'all need to have more fun and celebration, and to do it you just have to exercise imagination. Lord, Lord, let your laughter ring forth deep down in the South, way up in the North. Beloveds, be-eyed, outrageous freedom fighters. We are the people, we are the deciders. All right.
The Ballad of Molly Ivins here on Democracy Now!, democracynow.org, The War and Peace Report. I'm Amy Goodman. We're broadcasting from